issue of HIV is a national issue that we really have to deal with from a national standpoint, and that would include Carriacou and Petit Martinique. What is important to notice is that even up to now, after 30 years of having to manage HIV as a national level, there are still some serious gaps in people's knowledge, the attitude and perception to HIV. People are still thinking that it is not possible to transmit HIV from mother to child. People are still thinking that you can get HIV from using a utensil that an HIV positive person used. And so those gaps in our knowledge makes us realize that we need to keep educating people and keep our program going to allow persons to know the do's and don'ts and the important facts related to HIV transmission and treatment. And so it is going to continue to be a focus for us. Our program is being boosted nationally. We are in collaboration with the OECS Commission on a TB/HIV elimination project for 2030. What focus is on education and prevention and care and treatment for those who are HIV positive to allow them to live a full life without having to experience AIDS as we know it. The stigma and discrimination, if you ask me, is probably the most important limiting factor to our national HIV program. And there is really no reason for the stigma and discrimination, because the technology we have and the clinical management we have for HIV now far exceeds some of the common diseases that we have. People with HIV now can live a normal full life and die at a ripe old age, while someone who has cancer, for example, die much earlier. Someone with diabetes has a lot more complications. So there is really no reason for this. And I hate to have to say this, but unfortunately a lot of the stigma and discrimination occurs even among healthcare workers. And that makes it difficult for persons living with HIV. It makes it difficult for persons who are caring for others who live with HIV. And so that is going to be a focus of our national program. How do we manage some of the stigma and discrimination that exists among healthcare workers, and then extend that program to healthcare providers outside in the community, family members, and the stigma and discrimination, again, we have to keep saying it, that it is unnecessarily meted out to key populations or persons who don't necessarily share our perception regarding our ethics and morals and so on. As healthcare providers, when we provide care for persons, we provide care outside of their ideologies, outside of the values that they put on their lives. We are here to give a service to every citizen, and that is where it should stop.